I get asked a lot of questions about mouthwashes as to, is it necessary to use a mouthwash? If so, which is the best mouthwash to use? Can my kids use it? Does it have any side effects? When is the best time to use it? Can I replace my toothbrushing with my mouthwash, etc., etc.? I'm sure you also must be having those kind of questions. So in this video, I will be trying to bust as many mouthwash myths as I can. Hello and welcome, ladies and gentlemen, to my channel. I'm Dr. Helene Gill. Let's first try to understand what exactly is a mouthwash. So very simply put, it is just a chemical that has been used or is used to rinse the mouth, to reduce the number of bacteria in the mouth, and also to mask bad breath. That's it. So normally people think that it is to be used on a daily basis, just the way they brush their teeth or even do the routine work. So it is not a necessity that you have to use it because it is a chemical. It can cause side effects. Before I explain what sort of side effects it can cause, I would like to tell you why you could be prescribed one by your dentist. So your dentist may have prescribed you one or might prescribe you one in the future because you might be having an infection in your mouth, or it could be because you've had a surgical procedure performed in your mouth, due to which you are not able to completely or effectively clean your mouth with a toothbrush and a toothpaste. Or it could be because you have gum disease. Now, once you've been treated for these conditions, you should stop using it, because overuse can lead to side effects like increased stains, those brownish stains that you might see on some people's teeth. The stains can be seen on the soft tissues also. It can cause alteration of the taste. It can also cause allergies in some patients. Increased tartar on teeth has been observed. And another thing to be careful about is that majority of these mouthwashes have a high alcohol content in them. Some of them have so much alcohol that if you overuse that mouth rinse, it can cause oral cancer to develop. And these kind of cases are now increasing in numbers in the clinics because of the overuse of the mouthwash. It becomes really important to understand that these chemicals have to be used only when they are really required. Just like the medicines, we don't pop medicines in our mouth on a daily basis just because they are there. We just use them whenever they are required. Another thing I want you to keep in mind is that definitely do not give your children to use them, particularly children who are under the age of 6, because these children have a very, very strong swallowing reflex, which means that as soon as something goes in their mouth, they have the tendency to swallow it directly. And as you all know, mouthwashes are not to be swallowed, they are to be swished in the mouth, and you're supposed to spit it out after some time. The best way to use a mouthwash is to just use it. Either you can use it in a concentrated form or you can dilute it. And your dentist is the best person to guide you about that also. When should you use it? Do you use it in the morning or in the afternoon, before bed? When? Now that will depend upon the efficacy or the duration of time it is effective for. Some mouthwashes are effective for about 3 to 5 hours, which means that they are short acting. So those have to be used more frequently during the day. Others are effective for long duration of time, like up to 12 hours. So they might be just used for 1 or 2 times a day. And this has to be decided by the dentist again. So please follow the instructions given by your dentist carefully. The next question is, okay, now you have a basic idea how many times you have to use it, but do you use it before you have your food or after you have your food? And do you brush first, or do you use your mouthwash first? So again, get the directions from your dentist. Some dentists might recommend that you should brush first, have your food, and then brush again perhaps, and then use your mouthwash. Or you might be directed to have your food first, then brush, and then use your mouthwash. Here you need to be aware of one thing, that if you are going to use your mouthwash and your toothbrush one after the other in any sequence, make sure that there's a difference of at least half an hour gap between the two. So for example, if you are going to brush your teeth first, you have to brush first, wait for about half an hour before you use the mouthwash. The reason being that both of these are chemicals. Of course, the toothpaste that you're going to use is also a chemical, and the mouthwash is a chemical as well. So there is a chance that both these chemicals can interact with each other and nullify the effects, or the effect might be, reduced tremendously. So it's no use using both of them together. Another thing is that toothpaste have fluoride in them, which is a mineral that gets absorbed by the teeth to make them stronger. So once you've brushed your teeth, don't rinse your mouth with water, because the fluoride that remains in the mouth gets picked up by the teeth and it makes the teeth stronger. Some of you might be wondering, how does that happen? I've got another video about effective toothbrushing. Please find the link in the description box below, and you can get all the rest of the details about the fluoride and effective toothbrushing in that video. Some people also think that it is okay to replace their mouthwash, not the mouthwash, but it is okay to replace the toothbrushing with the mouthwash. So they become so lazy that they don't bother to brush their teeth. Instead, they just use the mouthwash. Please don't do that, because the role of the toothbrush is to remove the plaque physically. So it has a mechanical action, while the mouth rinse is just a chemical. So they have different roles to play, and the mouthwash is just used as an adjunct to the toothbrushing. So I hope that you will keep these things in mind the next time you are prescribed one mouthwash by your dentist, or you are using one at the moment. If you are using one at the moment, you should really stop if you've overused it. And if you think that you need to use it because it's helping you somehow, then I think that you should consult your dentist, get the right prescription from them, also get the right directions from them as to how to use it, for how long you should be using it, and which is the best time to use. Follow those instructions very, very carefully. I hope this video has been useful for you, and if you haven't yet subscribed to my video, please do so. Till my next video, don't forget to smile. Bye-bye.